High blood pressure is something that happens to people as they age. It's related to hardening of the arteries, the major vessels of the vasculature. It's related to obesity, poor diet, to salt in particular. These are the major contributors to high blood pressure. There are some secondary conditions that can also cause high blood pressure, but generally it is a lifestyle condition. Warning signs for high blood pressure. Oftentimes there's none. And some people even refer to it as the silent killer, meaning that you could have high blood pressure for a very long time, do a significant amount of damage to your health, and never really have symptoms until the very end stages of it. In some patients, they will experience neck pain or back pain or even sometimes chest pain. Sometimes they may have shortness of breath with it. I wouldn't rely on symptoms though to determine whether or not my blood pressure was normal or high. It does need to be checked and screened for regularly. Diagnosing high blood pressure is really easy. All it requires is a blood pressure cuff and a number greater than 140 systolic, which is your top number, or 90 diastolic, which is the bottom number, will essentially make the diagnosis of hypertension. However, we do want more than one reading. Generally, we want 2 readings at separate times to make sure this is not just the patient being scared or something we call white coat hypertension as the cause for the elevated blood pressure. And if we do diagnose it as greater than 140 or 90 systolic and diastolic respectively, we first will usually start them on lifestyle interventions unless the blood pressure is very high. So that's generally the diagnosis of hypertension. Prehypertension is between 120 and 140 systolic and 80 and 90 diastolic. Everyone should know what their blood pressure is. They should know it just like they know their birth date or their age. Getting their blood pressure screened on a regular basis is important because just because it was normal a couple of years ago doesn't mean it's still normal now. If your blood pressure is at all elevated, you should seek medical attention and make sure you're getting the medical attention that you need. There have been many updates in the way we treat blood pressure now. The number cutoffs are different. For elderly patients now, I often find that they're being overtreated. And for younger patients, I most often find that they're being undertreated or on inappropriate medications or medications that are now somewhat old-fashioned that we're not using anymore. So having your blood pressure treated is very important. It's the #1 risk factor for cardiovascular disease, and cardiovascular disease is still the #1 killer in the United States.